Good morning. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. Welcome back to Open Med School Journal Watch. Today's topic is on evening versus morning dosing of antihypertensives. The data is based on Cochrane Review 2024, the Time Trial, AHS Systematic Review 23, and the recent BETMET and BETMET-Frail trials. So first we look into the Cochrane review. This recent one, the version published in 14 February 2024. So the title is Evening versus Morning Dosing Regimen for Hypertension. Let us look into the background. Blood pressure, as we know, follows a circadian rhythm. Typically, it is lower at night and peak in the morning. Our goal is to have a 24-hour BP control for reducing cardiovascular outcomes. The previous Cochrane review was in 2011. And we know that the BP reduction with antihypertensives reduces cardiovascular events. However, the optimal timing is unknown. So this is the circadian pattern about which we were discussing. Here we can see that the blood pressure, the ambulatory BP recording dips at night and it goes to a morning surge. There is a rise in the BP in the morning called the morning surge. If the reduction is more than 20%, we call it as extreme dippers. 10 to 20% normal, less than 10 non-dippers. And in a few percentage people, the BP may surge at night. It may go up. This is called reverse or inverse dipping. The cardiovascular mortality is higher in those with the evening rise of or those with lack of the dipping. So the basis of the study is if the dipping is or the nighttime blood pressure reduction is made high, especially in those with non-dippers, the cardiovascular morbidity can be decreased. So the objective was to evaluate the effects of evening versus morning dose of antihypertensives on all cause of mortality, cardiovascular mortality and morbidity, total adverse events, and what is the BP level. So the search was done in Central, Medline, Embase and Chinese databases. It included RCTs comparing evening versus morning dose, excluded people with secondary hypertension. So those patients either taking all the medicines in the morning or those taking in the evening only are taken. The main results were 27 RCTs, around 3016 patients, the routine drugs, AC, ARB, CCB, beta blockers and diuretics. The finding was there is no significant difference in all-cause mortality, adverse events or blood pressure control between evening and morning doses. So there was so this is the summary. No significant difference in 24-hour systolic or diastolic blood pressure control between morning and evening doses. Cardiovascular outcomes, that is the heart attacks and strokes, were not significantly different. Overall safety and adverse effects were comparable between the two groups. So the conclusion, there is no strong evidence favoring either morning or evening dose of antihypertensive drugs in terms of Blood pressure control or cardiovascular outcomes. This is, remember, 2024. Now let us look into the time trial. Time trial meaning treatment in morning versus evening, that is the time trial. It is a large randomized controlled trial involving 21,000 patients and was published in 2022. Again, the objective was to determine whether the evening dosing of antihypertensive reduces major cardiovascular events. Again, the findings were same. No significant difference was observed in major cardiovascular events, heart attack, stroke, or death. Blood pressure control over 24 hours was also similar. So this trial emphasized the importance of adherence to treatment, which is more critical than the timing of administration. So blood pressure control and adherence to the medication was more important. So the conclusion, that is it, the diurnal changes in the administration of drug has got no effect on cardiovascular outcomes. In 23 there was in AHA, there is a systematic review, analysis of randomized clinical trials. Timing of antihypertensive drugs therapy is a systematic review and meta-analysis. There were around 72 trials. Patients were randomized to evening versus morning dosing of antihypertensive drugs. Except in one trial, that is the Hermida trials, all the other trials showed that there was no change in the cardiovascular outcome. The Hermida trials, which includes the MAPEC and HYGEA chronotherapy, suggested 61 and 45% reduction in adverse cardiovascular events with nighttime dosing. There was a lot of controversy on this. And the summary of the AHA systematic trial. The inconsistent result across trial, with some showing marginal benefit of evening dosing in controlling nocturnal blood pressure, while others showed no difference. And most trials indicated that adherence and consistency are far more important than specific timing. So the conclusion highlights that there is no strong evidence for favoring one dose regime over the other. It recommends individualized patient care based on lifestyle and tolerance. Now came the recent BETMED data, bedtime medication and BETMED frail trial. It undoubtedly pointed out that antihypertensives can be taken any time of the day. In the BETMED trial, the number is comparatively less, enrolled 3,357 hypertensive patients throughout Canada by 436 primary care providers. It was between 17 and 23. In the frail trial, 76 residents in care homes were included. This is from Canada between May 20 and February 24. In both trials, patients were randomized to bedtime or morning. The primary outcome was death or hospitalization for ACS, stroke, or heart failure. So what is the implication? Unless the intention is to specifically lower nighttime blood pressure, antihypertensive should be taken at a time of the day that is convenient to the patient, which optimizes adherence and minimizes undesirable effects. So in terms of advising prescribing once-a-day medication for blood pressure, patients can take them at whichever time best suits for them, depending upon their schedule and routine. Now we look into the 2024 ESC guidelines for hypertension. It emphasizes on convenience over timing. Current evidence does not show any benefit of diurnal timing or BP lowering drug medication on major cardiovascular events. It is important that medication is taken at the most convenient time of the day to improve adherence. If the patients prefer to take at night and they will not forget it, take it at night. Patients should be encouraged to take medication at the same time of each day. Don't shift from morning, evening. If it is taken in the morning, take in the morning every day. And ensure adherence. So this is the take home message. Thank you.